Story 1. My words became unclear. My memory deteriorated. I experienced unsteady walking and headaches. Initially, I thought I had multiple sclerosis due to my age and symptoms. However, it turned out to be a brain tumor, which is brain cancer with temporal lobe epilepsy. Although not completely cured and on my second recurrence, I am still alive. Story 2. Swollen lymph node on the left side of the neck. No pain, noticed it while shaving. Doctor prescribed antibiotics, but a week later there was no change in the swollen gland. He ordered a biopsy which confirmed cancer. For surgeries, 33 radiation treatments, and 6 chemotherapy treatments later, I am having CT scans and PET scans this week to hopefully show that I am now disease-free. All of this has occurred since January 6th of this year. Story 3. Unbelievable fatigue, the kind that just knocks you to the ground. I would be trying to make dinner and sit on the kitchen floor crying because I was so tired. I could sleep all day and never feel energized. For ovarian cancer, I also had pain where my ovaries were. I felt full even when I barely ate. For cervical cancer, strange bleeding occurred between periods. Both cancers started with extreme fatigue. Story 4. My gallbladder was filling with stones, and I was on the wait list for surgery. When visiting my doctor after an attack, I said that every time I had one, the lymph nodes in my neck swelled massively. 5 minutes later, we established that I did not know where the lymph nodes in my neck are, and I have a referral for thyroid cancer. Story 5. Mine was absolutely nothing, which is why it was scary. Someone told me my neck looked fat. I was skinny, so it was just my neck, and I thought I better get it checked. My wife is a doctor, so she had many doctor friends who all told me it was likely just some benign thyroid hypertrophy. Nope. Thyroid cancer at age 25. 40 now and thriving. Story 6. Long story short, I was ready to have sex with my boyfriend for the first time. I went to Planned Parenthood to get prepared. During the pelvic exam, the nurse asked if I was sure I had never had sex. I hadn't. She told me I needed to see a doctor and get tested. I agreed. She was very serious and called me that afternoon and every day for 3 days to make sure I understood I had to be seen. I went to the doctor, had imaging done, and they found a massive tumor in my intestines. My life changed. All is better now. Story 7. Long story short, a routine colonoscopy led to the discovery of a rare cancer. I have said this before. Do not avoid routine screenings recommended by doctors. If I had not had mine, I would be dead. Now I am cancer-free and doing fine. Story 8. Not me, but my daughter. The first time, at 11 years old, she had pain in her shoulder. The doctor dismissed it. A week or 2 later, there was a bump. It turned out to be Ewing's sarcoma in her scapula. She underwent 1 year of chemotherapy and an operation. For 2 years, she was tired, not growing, and needed medication to start puberty. At 14, she came down from her room to show me a massive bruise on her lower leg. It was Mother's Day. Within 24 hours, she was in the hospital again with secondary acute myeloid leukemia, a type of blood cancer caused by the chemotherapy she received for the Ewing sarcoma. She spent 8 months in the hospital and had a stem cell transplant. Unfortunately, the leukemia could not be cured. My beautiful Daisy died on February 1st, 2022. She will be forever in my heart. Story 9. Extreme fatigue. It got to the point where just getting out of bed was exhausting. I never felt well rested no matter what I did. I finally went to the hospital where the doctor instantly knew I had been suffering blood loss. He ordered multiple tests and they eventually found the growth in my stomach. I had been bleeding microscopically for months, possibly even years, and my body was able to adapt because it was so slow. My hemoglobin count was at 4.4. The doctor said it was a miracle I was still alive, let alone conscious. They biopsied the growth and I was diagnosed with stage 4 neuroendocrine cancer. That was 2 years ago. Multiple surgeries later and most of the cancer has been removed. Story 10. I went to get a magnetic resonance imaging scan because I had a mass growing on the side of my head. It seemed like it grew overnight. It was a benign bone tumor called osteoma, but when I got the scan results, it turned out I also had brain cancer. a golf ball-sized grade 2 solitary fibrous tumor. I had a craniotomy in 2023. I have had 2 recurrences in under a year, followed by radiation therapy. I am currently waiting for my next scan. Fingers crossed we eliminated the tumor. Story 11. I was having surgery, and I had blood work done the day before admission. My leukemia was found then. I had no clue, and my white blood cell count was over 100,000 and platelets were 750,000. You would think I would have noticed something was off. It was my first time having a serious illness apart from colds, flu, and strep throat, and it is incurable. Lucky me. Story 12. My face and neck became very swollen, and at first I thought I was just gaining weight. What finally motivated me to seek help was the development of unexplained bruises on my chest and difficulty breathing. It turned out I had a large tumor in my chest that had grown around my heart and was restricting blood flow to my head. That was 17 years ago, and while I have some lung and hearing damage from the chemotherapy, I am otherwise fine. Story 13. My cousin's husband was in his early 40s and was experiencing bowel issues, including bleeding and pain. This was in November of 2018 or 2019, if I recall correctly. He had been postponing medical care because he was a typical man who did not visit doctors. He underwent a colonoscopy. They diagnosed stage 4 colon cancer, and it had spread extensively. Chemotherapy allowed him to spend Christmas with his children and family. He passed away just a couple of months later, in February of 2019 or 2020. Please get screened. He left behind 2 children under 10 years old. Story 14. My mother started having extreme fatigue 4 weeks ago. She was sent for blood work, which showed nothing remarkable except low white blood cell count. Then she had more blood work and a lung X-ray. Meanwhile, she was exhausted and freezing at night. She was waiting for an appointment with her doctor on June 24th. Finally, she went to our medical group's urgent care, and they admitted her directly to the hospital. More tests were done, including a critical white blood cell smear test, and we found out she had acute myeloid leukemia. She was told that if she was transferred to the local cancer hospital and agreed to 6 weeks of chemotherapy, her bone marrow situation might improve, and she would live 9 months. If she did nothing, she would die in 8 weeks. We were just staring at each other, shaking our heads. There was no way she would do chemotherapy just to get 9 months. She was 84 years old. She was discharged to my house under hospice care and died last Wednesday, July 10th, 17 days after diagnosis. 5 weeks ago, she was zipping around in her 5-speed Impreza, totally active. Now she is gone. Story 15. I had a sharp pain in my left breast. I went to my doctor about the pain. She sent me for a mammogram and an ultrasound. They found a growth in my right breast. It was found very early. The growth was 6 millimeters. Story 16. Severe fatigue, night sweats, loss of appetite, excessively quick weight loss, low blood pressure while being diagnosed with hypertension. When I say fatigue, I mean I would be mid-sentence and fall asleep because I had no energy left. I would walk to the bathroom and needed 30 minutes to recover from the exertion. Then my throat started to feel like I was swallowing daggers, and my lymph nodes started to swell, so I figured I had strep throat again. All the other symptoms felt explainable, and even though I had lost my appetite and was losing weight, I personally was not noticing those changes. It was others who brought it up to me. I finally went to urgent care for what I thought was strep throat. It turned out I had a rare type of leukemia. These symptoms came on quickly. Within a month of the fatigue, which was the first symptom, the others started happening quite rapidly. Doctors said I was days away from dying if I had not come in. On the 21st of this month, I will have hit my 2-year mark since my stem cell transplant, and I am doing great. Story 17. A hard area on my left breast caught my attention in the shower. It was not a defined lump, but noticeably harder to the touch than the rest of the breast. I was diagnosed with stage 2, grade 3, triple-negative breast cancer. Please check your chest regularly. All genders have breast tissue. I was 34 years old when diagnosed. So do not let any doctor tell you that you are too young for cancer. You know what is normal for your body. If something is not normal, advocate for yourself. Story 18. Not me personally, but my wife. She woke up one morning 2 years ago with an inverted nipple. A mammogram showed a lump buried deep in breast tissue that could not be felt or noticed otherwise. Further CT scan revealed it had spread to the left lung, lymph nodes, and bones. It was stage 4 and terminal. Secondary inflammatory breast cancer. It is frightening how it reached this stage with zero warning signs. Story 19. Not me, but a family member, 38 years old and exhibiting signs of colon cancer, weight loss, extreme fatigue, bleeding. Recognizing something was wrong, they went to multiple doctors and were told it was anemia, anxiety, and hemorrhoids. By the time they convinced a doctor to perform a colonoscopy, which had not been done because they were considered too young for colon cancer, it had spread to stage 4. Sharing this as a cautionary tale to advocate for yourself until you get the tests you need. You know your body, and if something is not right, ask questions, advocate for yourself, and do not be convinced it is just anxiety because you do not fit the common age or demographic for cancer diagnosis. Story 20. My small dog was preoccupied with the left side of my chest and began, over a period of weeks, pawing, sniffing, and eventually jumping on that side. I had no feeling of discomfort or pain, but eventually discovered a lump. My physician confirmed it as stage 1 cancer. My dog knew something had changed by smelling the site, and I would never have bothered to check otherwise. I was an otherwise healthy man with no family history of cancer. Man's best friend. Story 21. I had a chronic choking feeling in my throat. The tumor was found on my thyroid. The choking feeling did not go away after surgery. It turned out to be chronic sinusitis, unrelated to the thyroid cancer. Story 22. Blood in my stool, loose stools, and pain in my rectal area for about a year. I underwent a colonoscopy and was diagnosed with stage 3C rectal cancer. I am just beginning treatment now. Story 23. I felt a lump in my abdomen only when relaxed and lying down. I went to get it checked out. An ultrasound followed by a biopsy showed it to be a large 12 by 18 centimeter metastatic melanoma. If you notice something unusual in your body, go and get it checked. Story 24. I had a cold that took a long time to go away, and at one point, I noticed that my left side was a little swollen. I immediately considered that I might have mononucleosis because I knew that causes your spleen to swell. So, I booked a doctor's appointment and they did a blood test for mononucleosis. The results came back. I did not have mononucleosis, but my white blood cell count was 30,000 times higher than it was supposed to be. Turned out I had chronic myelogenous leukemia, also known as chronic myeloid leukemia. My spleen was swollen from it, though. The good news is that it is one of the best types of leukemia to have. I just take a pill every day, and my life expectancy is basically the same as any random person. Here I am, 14 years later, to prove it. If I had not treated it, I would have been dead within 5 years. Story 25. Weird small patch of dry skin on the end of my nose. After a shower, every now and then I would pick at the top of it and it would bleed. I thought it might be a mole, so I figured it was strange. I had an accident and broke my nose. A skin specialist covering on the weekend spotted it and referred me for a biopsy. After a series of surgeries, I am now free of skin cancer. Story 26. I am cancer-free now, but my main symptom was coughing blood and a persistent cough. I was a smoker, so I dismissed it as a smoker's cough for over a year and did not visit the doctor until the blood became frequent. It turned out I had a rare type of hormone-related tumor on my lung called a neuroendocrine carcinoid, which has no connection to smoking. Fortunately, I was treated with surgery only and had my right lung removed in 2023. That was the end of it. Story 27. After I lightly ran my fingers through my beard, I saw a smear of blood on my fingers. My primary care doctor referred me to a dermatologist who removed a basal cell carcinoma from my face. Basal cell carcinoma rarely spreads, so the hope was that no further treatment was needed. 8 years later, I felt a small bump on the skin in the same area. I went to the dermatologist to get it checked. That was fine, but she asked me to take my shirt off for a skin check while I was there. It took less than 5 seconds for the doctor to notice something that did not look good on my shoulder. She biopsied it and it was melanoma. Melanoma is the deadliest skin cancer. Get your skin checked, everyone. These are areas that are hard to check yourself. Find it early, get it removed, and your chances are excellent. Story 28. It was my husband, but he kept complaining about stomach pain and insisting it was constipation. I made him go to the hospital because it did not seem right. They found a large mass in his intestines and diagnosed him with a super rare gastrointestinal stromal tumor. It is a radiation-resistant form of cancer, and treatment consists of surgery and chemotherapy. He is going through round 4 right now. Story 29. I had been feeling some fatigue in the evening, but that did not cause me to see a doctor. My cancer was caught only because I needed to renew some prescriptions, and the doctor offered to do a physical exam since it had been a little over a year since my last one. She felt something in my chest that should not be there, and that is how I learned I have kidney cancer. Story 30. I was losing weight uncontrollably and noticed some blood in the toilet after bowel movements, combined with pain while going. A colonoscopy found a tumor. Luckily, it was at a very early stage, so removing it was the treatment. By the time I knew I had it, it was already gone. Story 31. I am posting this on behalf of my wife, who did not survive. We had a 1-year-old at the time who was not sleeping through the night, so the fatigue, more than usual, was missed and dismissed. She just tried to power through with coffee. The main reason she sought medical attention repeatedly was a strange feeling in her throat. She said she had a dream that she swallowed one of her Bluetooth earbuds. But when she woke up, she still had both earbuds, although she also had a sore throat. That sore throat kept getting worse during flu season. The first couple of times she went to the emergency room, they only ran flu and coronavirus tests and dismissed her symptoms when the results came back negative. It got so bad that she had difficulty swallowing food, but she still tried to push through until it became hard for her to drink liquids. Mind you, this was only about 2 weeks. Long story short, she had acute myeloid leukemia, and the issue in her throat was actually a fungal infection because her immune system was compromised. Between her diagnosis on December 11, 2023, and her passing due to chemotherapy complications on January 7, 2024, it was less than a month. She was only 42 years old. Trust your gut instincts if something feels wrong, and never feel bad about asking for more testing. It is your life, not theirs. Story 32. My husband was having migraines, anxiety, and vision issues. He thought his prescription was just getting worse or that something was happening due to a sports injury he had in his eye. He went to the eye doctor. The doctor examined him and immediately sent him to the emergency room to rule out a brain tumor. He passed away from glioblastoma 2.5 years later. It is random and untreatable, but he suffered from severe anxiety and vision problems for longer than necessary before he was diagnosed. Story 33. Low back pain that was not like normal back pain persisted until the physician assistant at my doctor's office ordered a computed tomography scan, mostly to prevent me from returning repeatedly. A day or two after the scan, I received a call from a urologist in the same practice asking if I could come in that afternoon. I was diagnosed with kidney cancer in the right kidney. It was still small, so robotic surgery to remove it was successful. Every follow-up was clear until year 5, when a lesion appeared on the other kidney. I never had any symptoms except that initial back pain, which was just different. 2 years later, I had thyroid cancer, which had no noticeable symptoms, but a new doctor thought the thyroid felt slightly enlarged. Sure enough, I had to have the thyroid removed. The cancer was advanced and had spread to lymph nodes. After many surgeries, things are stable. This is year 13 of various cancer battles. Doctor appointments never end, but it beats the alternative. Always remember that you are in charge of your treatment, not your insurance company. Story 34. Not me, my mother-in-law. She had an annoying bump on her belly button. She ignored it for probably 2 years, ignored it for a while, then COVID-19 hit and she didn't want to trouble her doctor. Finally, she went in to have it looked at in 2021. The doctor suspected an umbilical granuloma, a totally benign condition going into the appointment, but quickly confirmed that she had pancreatic cancer. What she had is called a Sister Mary Joseph nodule. Her cancer at that point was very advanced and had spread to her lymph nodes and other organs in her abdomen. She passed away 3 weeks ago, 3.5 years after being given 6 months. Do not ignore things that are odd but seem insignificant. Story 35. I just had an odd little tickle in my throat. I thought I might have had a chip from some dental work create a cyst. It turned out to be squamous cell carcinoma of the right tonsil. I am about 4 years since finishing treatment, and everything looks good. Story 36. Funny story. Related. I throw some blueberries in my smoothie every morning. Our local supermarket had sold blueberries contaminated with hepatitis A. It turns out that those blueberries might have saved my life. In February, I was having fever attacks and mild lower back pain, so I went to visit the doctor because that could indicate an infection in a vertebra. I was sent for an echocardiogram and X-ray. It turned out that I had a large tumor from testicular cancer in my lower back. The blood results showed I had hepatitis A as well. If I had not had those fevers from the hepatitis A and only had mild lower back pain, I might not have gone to the doctor so quickly, or I might have been sent to a physiotherapist first. I had surgery and chemotherapy since then, and I am now recovering and waiting for the next scans in August, after which I will probably need radiation or another surgery. My chances of getting through this and becoming cancer-free are almost 100%, so I am really happy I was eating those contaminated berries. Story 37. To the hypochondriac doom scrolling this thread, you know who you are. Stop scrolling. Go do something that brings you joy, and give your brain a break. Story 38. Unfortunately, no chronic symptoms, but had 2 stool-related events. Coffee ground stool and bright red blood in the bowl. Both resulted in no findings except exorbitant emergency room costs. Since my family has a history of colorectal issues, I requested a colonoscopy to determine the cause. It turned out to be a stage 2, mildly malignant tumor, with nothing unusual appearing in my blood tests. The bleeding event was probably semi-unrelated, caused by a polyp bursting. After surgery removing 16 inches of large intestine, I am fine, having defeated cancer for now. Story 39. Went for an ordinary mammogram after being reminded by my doctor during a physical. Found a mass and had a biopsy. It was so small it was stage 1. Had a lumpectomy and a course of medication, and I am fine. I will never miss another routine checkup. Ever. Story 40. Not me but my mom. She is an immigrant and her job at the time did not provide any health insurance, and we were low income. Her friend had a lump on her breast and was hesitant to go. But my mom convinced her and said she would get screened as well to make her feel better. Her friend's lump was benign, but my mom also had a lump and we found out she had stage 3 breast cancer. That was back in 2013 to 2014 when the Affordable Care Act was being expanded to remove out-of-pocket expenses for preventive screening. 10 years later, she is completely cancer-free. I know lots of people who are into politics on the left and right like to criticize Barack Obama, but he truly saved my mom's life. My family would not have climbed out of poverty and thrived without these changes. Story 41. Almost bled to death. Went to find out what was going on. Found out I had uterine cancer. Had surgery with no radiation or chemotherapy. It has been 10 years and I am still cancer-free. Story 42. My kitten obsessively licked my armpit, which led me to discover a lump in that same armpit. This resulted in a stage 3 breast cancer diagnosis. Story 43. I started seeing blood in my stool. It was intermittent at first, but then I began seeing it more regularly. At one point, blood leaked into my underwear and there was a lot of blood in the toilet. I made an appointment with my general practitioner, who referred me for a colonoscopy. They found a tumor that was stage 4. I already had a full schedule of chemotherapy followed by surgery, but the cancer returned. The prognosis is poor. I am a white male with no family history of colorectal cancer. I was diagnosed at 35 years old and am now 38. I would not have been due for my first colonoscopy for another 10 years. Story 44. Not a cancer survivor, but genuinely here to read and learn. These stories save lives, especially for those of us who tend to ignore minor symptoms. Much respect to everyone sharing. Story 45. I had, and still have a couple of spots on my face that seemed irritated too often. I have been fortunate enough in life to very rarely get pimples, so I noticed them immediately but thought at least one was due to where my sunglasses sit, plus clogged pores from sunscreen or something. I never had skin problems, and no one had ever noticed my cancer spots. I finally realized that the irritation had been recurring for too long and flew to another state to get it checked out because it is cheaper to fly their round trip and be treated by a dermatologist than to be seen 10 minutes from my house. They confirmed both spots were cancerous, and I underwent chemotherapy. One spot has persisted, and I will likely have surgery. My only real concern is how close it is to my eye and sinus, so hopefully it will be a quick procedure without affecting those areas. Fingers crossed. Story 46. My left testicle was firm, and then I was diagnosed with stage 2A testicular cancer, non-seminoma, which means it is more aggressive in spreading. They scheduled me for orchiectomy and port surgery a month apart. I am now in my 3rd week of infusion. Story 47. Not me, but a close friend of mine had what she thought was the flu and couldn't shake it. After 2 weeks of feeling very unwell, she went to the general practitioner. The doctor suspected a urinary tract infection that had turned into a kidney infection and told her to go straight to the accident and emergency department. There, they took a blood sample and found she had an extremely low white blood cell count. It turned out she had stage 3 non-Hodgkin lymphoma. She was only 31 when she was diagnosed. She spent 6 months undergoing intensive treatments and now she is in the clear. Afterward, she quit her job, left her boyfriend, went to San Francisco for a month, came back, and adopted an elderly cat. Now she enjoys wild swimming. Story 48. I was 16 weeks pregnant and in nursing school. One morning, while receiving the patient handoff report, I felt faint, and my instructor took me to the emergency department. Because some of my laboratory tests were abnormal, they performed a computed tomography scan to rule out a possible pulmonary embolism. They found a mass in my right breast, and about 3 weeks later, I was diagnosed with breast cancer. I had felt a small lump but thought it was related to pregnancy breast changes. Passing out from pregnancy may have saved my life. I have been undergoing chemotherapy throughout my pregnancy and am about to give birth any day now. Hopefully, I can survive to watch my children grow up. Story 49. Early 40s and decided to start annual mammograms. The first one was a little suspicious, but the ultrasound looked okay, so I was scheduled for a 6-month rescan. That one led to a biopsy, which resulted in surgery to remove both breasts. Story 50. I am speaking for my late wife. It took me, as her husband, to make an appointment with the dermatologist because she had a mole on the back of her thigh that I thought looked angry. It turned out to be stage 3 metastatic melanoma. I wish I had caught it sooner. Maybe then I would still have my sweet girl. Story 51. I have an autoimmune disease called ulcerative colitis. I undergo a colonoscopy every year, during which biopsies are taken. Twice, I was diagnosed with stage 1 colon cancer in different 2 to 3 inch sections. Y experiencia no symptoms. I underwent radiation therapy 3 times a week for 6 weeks. When I was 30 years old, I was diagnosed with breast cancer. I had a tumor removed and underwent chemotherapy and radiation therapy. I am now cancer-free. Story 52. Not me, but my husband. He had a cough that would not go away and night sweats. X-rays revealed a mass in his chest, and his doctor immediately sent him to the hospital. He was diagnosed with Hodgkin's lymphoma and fought it for almost 2 years. I still think about him every day after 20 years. Story 53. My dad started having issues with computer tasks like Excel sheets and typing. Then he experienced pain in his neck and struggled to move his head. He was diagnosed with glioblastoma grade 4, the most common and most aggressive brain tumor, in February 2024. He underwent chemotherapy and radiotherapy, but the tumor was not removable by surgery. He died 3 weeks ago. If your cognitive functions start to decline, see a doctor. Story 54. I had a 9-month period that was incredibly heavy and underwent an ultrasound of my uterus. It turned out I had an endometrial tumor. I was given progesterone for about a year. Then they removed my uterus, fallopian tubes, ovaries, and other related tissues. I had a stage 1, grade 1 tumor. About 3 months later, I had some additional bleeding and learned I had a recurrence at the surgical site. I then experienced pelvic radiation. I received a clean scan in April, and now I am waiting and watching, trying not to live in fear of a return. I am definitely keeping up with my checks for other cancers such as breast and colon. I am grateful it was discovered so early. Get your checks, everyone. Story 55. What made me go to the emergency room was unbearable abdominal and back pain that came and went, as well as tightness and ache in my leg that had been happening for almost 2 months. The abdominal pain was caused by an 18-centimeter tumor in my ovarian cancer, and the leg pain was a deep vein thrombosis caused by the cancer. In retrospect, cancer-wise, I also had to urinate constantly, felt nauseous frequently, and had a general feeling of fullness. Story 56. My mom found out she had kidney cancer from a random scan. It was localized, so they removed the entire kidney. The next place this type of cancer could spread is her lungs. We just found out about a month ago that it has spread there. I would say she was healthy and we never saw it coming, but cancer does not care. Thank you for the support. We are talking about a disease that does not discriminate by age, infants, children, young adults, parents, or grandparents. Kills without regard. Everyone I have ever known has died of cancer. It has made me numb. She is undergoing immunotherapy instead of chemotherapy. She had an infusion 3 days ago and is currently in bed, not feeling well. I am an alcoholic, 2 years sober, and I feel like I am going to die young. I wish I could take their sickness away and bear it myself. My grandmother, my mom's mother, had breast cancer at age 97. They removed it and she is still doing well. That was 2 years ago. Story 57. Weird and extreme weight gain despite intense and regular workouts, a clean diet, and a lifetime of grappling. Then depression and fatigue began. Every medicinal treatment tried only worsened the situation, and the uncontrollable weight gain continued. Every time someone dragged their arm across my throat or touched it lightly, which happens often when grappling, it triggered fits of gagging and choking. Doctor after doctor, test after test, my medical teams claimed I was fine. I moved, found a new doctor. He touched my throat. I gagged and coughed. He said, "That's not right." A few weeks later, I underwent the first of several cancer surgeries. I went years with cancer that could have been easily treated if the doctors had listened to me at the outset. Instead, it was allowed to grow, and I am lucky they finally caught it, even if it was by chance. Story 58. Speaking for a relative who has breasts and a lump. She had a mammogram 6 months earlier, but it was clear. The reason I am sharing this is that if you have firm, dense breasts, mammograms may not be as effective. Breast density makes it difficult to detect masses. If you have firm breasts and find a lump, do not assume you are fine because you recently had a mammogram. If you find a lump in your breast, get it checked immediately. The sooner you address it, the better your chances are. Story 59. My mom died of lung cancer 3 weeks after diagnosis in February 2023. My dad was 59 at the time, and a few months after she passed, he developed a dry, persistent cough. He was afraid he had lung cancer, but we reassured him he did not because he was healthy, active, and never smoked. However, 5 months after my mom passed, he was diagnosed with stage 4 epidermal growth factor receptor lung cancer. He passed away 2 months ago at 61 years old, 22 months after diagnosis. Story 60. Not me, but my father found out because his favorite foods did not taste the same anymore, particularly broccoli. Story 61. Where I live, you receive invitations to routine checkups for certain kinds of cancer according to your age. I turned 30 this year and got my first invitation. I found out I am in the very early stages of cervical cancer. I have no symptoms, but if I had waited until my next invitation, 2 years later, the situation would have been much worse. I am scheduled to have it removed near the end of the month, and I am hopeful that will be the end of it. So, a little reminder, never skip routine checkups, even if you do not have any symptoms or complaints. Story 62. Melanoma at 29 years old. The center of a mole I have had forever just fell out in the shower. After putting it off for weeks, I finally went to see a general practitioner. Thankfully, it was stage 1A, so just one further resection to get clear margins. Then all was good. I am now very paranoid, though. Story 63. Not me, but my dad. He was asymptomatic. He has had his prostate-specific antigen test done yearly since age 35. He is 62 now. He has his annual labs, which have always been normal, but recently his levels became elevated. After making some adjustments and retesting, the levels were even higher. Long story short, he has stage 3C prostate cancer with Gleason score 9, with 10 being the highest. It is a highly aggressive form of prostate cancer. He is currently in the process of scheduling surgery and treatment. If he had not had his prostate-specific antigen checked, by the time he showed symptoms, he would probably be dead. He feels completely fine. It was literally a coincidence that the cancer was found. Story 64. I started losing hearing in one ear, as if everything was on and off muffled. I thought I was just having chronic ear infections because I was on an immunosuppressive drug. It turned out there was a tumor in the nasopharynx blocking my eustachian tube from draining the fluid in my ear. It also affected a lymph node nearby. I received radiation therapy and chemotherapy. Now, I am going on 6 years cancer-free. Story 65. Elbow pain. I was crocheting up to 12 hours a day, so I thought that was the cause. I ended up having surgery for carpal tunnel syndrome and cubital tunnel syndrome. When insurance finally approved a magnetic resonance imaging scan, it found a massive tumor on my spine. Symptoms progressed quickly after that, and now I have spinal cord damage. My left hand is now paralyzed. I really miss crocheting, and I am relearning to walk. 14 rounds of chemotherapy and 31 radiation treatments later, I am technically cancer-free, but my life will never be the same. Story 66. A cold that wouldn't quite go away. Fatigue that I couldn't shift. Eventually followed by chronic night sweats. I went from thinking I was sweating from a bad cold to changing pajamas 5 times a night. I had been going back and forth to the general practitioner for weeks, being given antibiotics and nasal sprays. A rash appeared, which was actually a classic lymphoma rash, but the doctor said I was having a reaction to an antibiotic. I won't even get into how condescending all the male medical staff were. My favorite reasons given for my night sweats were that I was just being premenopausal, my husband was running too hot at night, or I maybe had mononucleosis. I eventually begged for blood tests, and everything that could indicate a warning came back abnormal. I was told to schedule a hematology appointment, but before I could do that, I was hospitalized with severe liver and spleen pain. I spent 2 weeks in the hospital being tested for autoimmune disease, infectious disease including deep-rooted tuberculosis and lymphoma. It turned out I was stage 4 classic Hodgkin lymphoma. Story 67. Intuition. Going through perimenopause, I was experiencing very irregular periods, sometimes lasting for a full month. For some reason, my Papa Nicolau test results kept coming back inconclusive. My doctor, whom I normally like and respect, dismissed it, saying it was likely just perimenopause and probably nothing to worry about. However, I had a nagging feeling for no apparent reason. A week later, I contacted the office and requested another appointment. The clinic responded and scheduled a consultation with a different doctor for a second opinion. She performed a biopsy, which revealed severe endometrial hyperplasia. She then recommended a hysterectomy due to the high risk of it developing into cancer sooner rather than later. I often think of women who are told they are fine, but are actually dealing with serious health issues. I just knew something wasn't right. Story 68. I had cancer, leukemia, but I am clean now. The symptoms were pulsating lymph nodes, craving to eat dirt, and really liking the smell of a basement. The last 2 were symptoms of anemia. Story 69. I kept feeling sharp pains in my breast, but my doctor and I assumed it was hormonal. Manual breast examination was clear. Routine mammogram, however, identified 2 areas of concern, and it ended up being 2 separate cancers with one tumor nearly the size of a golf ball. Just get checked. It is worth the peace of mind, if nothing else. Story 70. I felt a lump in my breast that did not go away and got bigger. By the time I got insurance and was able to see a doctor, it had spread to my hip. After 1 year of chemotherapy, 30 radiation treatments, and 9 surgeries. I currently have no active cancer, but I am stage 4 for life. I am under 40 and have chemotherapy-induced neuropathy in my feet. Check your breasts, everyone. Story 71. Telling this story for my dad because he is not here to tell it. A dermatologist diagnosed him with stage 4 pancreatic cancer. He was there for a skin biopsy but hemorrhaged constantly for 3 weeks afterward. I took him to 4 different hospitals and none of them helped him. They just repacked and discharged him. Finally, he went back to his dermatologist, who immediately ordered endoscopic imaging when he noticed my dad saying his stomach was bothering him because he did not have his daily bowl of dairy products. Ice cream. There was a 4-centimeter tumor in the pancreatic bile duct extending to the liver. They stented it open, gave him 6 months to live, and he clung to every single day. He died 6 months exactly to the day. My dad was an absolute workhorse who saved kids' lives just by being lucky, helped anyone who needed it, and was the best dad ever. So if you are reading this, have a bowl of dairy products for Joey J. Story 72. Not me, but my friend, only 28, mentioned her dog had become obsessed with one of her breasts. Pawing it, smelling it, threatening to bite it. I said I had heard dogs could smell cancer, so she went to the doctor and yes, she had breast cancer. My dad, who died of lung cancer, had a pain in his shoulder that would not go away. My mum, who had breast cancer, said she hit her breast on a trolley in the supermarket and the bruise just would not fade. It lasted weeks. A neighbor with ovarian or cervical cancer felt pregnancy symptoms and had a positive pregnancy test. Even though her husband had had a vasectomy, she went to get it checked out and found it was cancer. She was relieved as her children were early teens and she did not want another baby. Her cancer had been caught early, so her treatment was quite simple. A colleague with testicular cancer, who would update us by email to raise awareness, said his urine smelled funny and he started struggling with body odor. My grandfather had cancer 7 times in total. After the first 3, he said he just knew before any symptoms appeared. The last time, he told his doctor he knew he had throat cancer, but the doctor said it was just a sore throat and told him to gargle honey and lemon. That cancer was caught too late. I do not think I know anyone who had cancer who found it in a normal way. Story 73. Long story short, I went in for a routine blood test. The doctor noticed I was coughing, asked how long, and sent me for a chest scan because I had been coughing for 5 to 6 months. I did not feel sick. Plot twist. It was not bronchitis. A mass had grown large enough to begin pushing on and irritating my lung. Story 74. But my toddler has leukemia. It was the overwhelming fatigue for us. We took him in several times until a doctor took it seriously and did some blood tests. The nap lengths were unreal, and he was always exhausted regardless of sleep. Story 75. I had a lump on my breast that did not go away. It got bigger and harder. By the time I went to the doctor, I had stage 3 breast cancer. Now, 10 years later, I have metastatic breast cancer in my spine. Story 76. My dad started having unusual cognitive symptoms, but he had multiple sclerosis and had experienced similar issues from a urinary tract infection. We thought this was the same, another urinary tract infection. However, he had also been complaining of severe headaches and toothaches, which we thought were dental related. He went to the emergency room and tests showed lesions on his brain. A biopsy revealed they were melanoma. We still have no idea where the melanoma originated. He stayed with us for 6 months after that. Next week, it will be 1 year since we lost him. Please use sunscreen and get your skin checked, especially if you have relatives diagnosed with melanoma. Story 77. My brother had all the symptoms of pregnancy: weight gain and morning sickness. One doctor even tried to diagnose ovarian cancer without seeing the ovaries. Story 78. I was 23 years old, and this happened during the COVID-19 pandemic. I experienced horrific chest pains and extreme fatigue. I went to the emergency room and was told the symptoms were caused by anxiety. They planned to do a CT scan, but could not get an intravenous line in. The pain worsened, and I began losing weight without trying. I returned to the emergency room a couple of months later, had a CT scan, and it revealed a massive tumor in my chest restricting my lungs and growing into my heart valves. I started chemotherapy the day after the diagnosis. Story 79. That nagging voice in my head kept saying, you know, there is a chance that may not be psoriasis. And it was not. It was basal cell carcinoma. It was precancerous, but if I had carried on ignoring that voice, it would not have been. I had an area of skin on my face that grew patchy and uneven, scabbed over, dropped off, grew a little larger, scabbed over, dropped off. It just never healed. Now I have a zigzag scar like Harry Potter and no feeling in an area of my scalp about the size of an apple because of nerve damage. That will be permanent. I am considered high risk for recurrence. Story 80. Had stabbing pains in my stomach. Blood tests and urine tests showed nothing. Had an ultrasound looking for stones and found what they said was a ureterocele in my bladder. Went to have a cystoscopy to see if this harmless ureterocele should be removed. It turned out it was not a ureterocele at all but cancer. It was caught early with nothing showing in blood work. The strange thing is, during these tests over a couple of weeks, my stomach pains disappeared. It turns out the pains were not even related. Story 81. I had no symptoms. My mother was diagnosed with cancer a few months earlier, and I went to the doctor for genetic testing. It turned out that I also had cancer at the same time as my mother. Story 82. I had no idea. I took a fall and needed stitches. When they scanned my head for a concussion, they found a 5-centimeter tumor on my thyroid. There was a short time when everyone thought I had thyroid cancer, which was scary but manageable. Unfortunately, it turned out to be a genetic condition that predisposes me to neuroendocrine tumors and paragangliomas. I have surgery in 4 weeks and then a lifetime of watchful waiting. Story 83. My son's eye was drifting to the side, similar to a lazy eye at 12 months old. We went to the eye doctor and, long story short, he has bilateral retinoblastoma. It is usually identified by the pupil looking white instead of red in photos, but we caught it early. Now at 14 months old, he will be having his 3rd round of chemotherapy this week, followed by another 3 rounds. Story 84. Constantly tired with no other symptoms. I had colon cancer, which was caught early because my general practitioner took me seriously, even though I never went to the doctor before. Story 85. Intense night sweats, shortness of breath, easy fatigue, and chest pain at the very end. I went to the doctors. Keep in mind, this all happened in a couple of days. They performed various scans, and I felt like I was on an episode of House as they looked at me perplexed. A couple of days later, I was diagnosed with acute myeloid leukemia. I fought hard and had my brother as a stem cell donor. Now, I am almost 2 years cancer-free. Story 86. I found a tender lump in my left breast when I lay on my belly. I went for a mammogram and the left breast was normal. The right breast had 2 cancerous clusters. I am convinced that my left breast was trying to warn me. It had been less than a year since my last mammogram, so it was caught very early. I did not need chemotherapy. If I had waited until my next scheduled mammogram, it would have been much more serious. I am very lucky. Story 87. I had persistent diffuse abdominal pain. I had a computed tomography scan, and they found a tumor on my pancreas which turned out to be cancerous. I am currently in remission. Story 88. A lot of cancers are detectable and treatable if you catch them early enough. You do not need to be paranoid about it, but get your yearly physical examinations, do your screenings on time and as early as possible, and make regular checkups with a dermatologist. None of it is hard and can literally save your life. Story 89. A patch of lumpy tissue that did not feel like the typical pea-sized lumps you would normally think to look for. I went to get it checked anyway, and it turned out to be breast cancer before age 40 in the lymph nodes too. After a year of treatment, I am now okay. There was a neck lump recently, but thankfully it turned out to be benign. Always check yourself and get to know what feels and looks normal or unusual for you. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.